Don't want to, you don't want to have them repeated too much, because you're gonna have people get dizzy and hyperventilate, okay? So, we're gonna start with inhalation, improving inhalation. So inhalation is what creates regular inhalation, not deep. What creates it, what
Negative.
what happens? Okay. Diaphragm goes down, but what it's really, what'd you say?
Negative pressure.
Yeah, it's after an exhalation, you have rebound inhalation because everything is kind of stretched down, okay? So, but if you want to take a deep inhalation, then it's the diaphragm that's moving down, okay? So with PNF, what we're going to do is we're going to, if you want to improve inhalation, you're going to enhance that negative pressure or the rebound by putting a stretch on the rib cage. Okay, so what you're gonna do is put your hands on the rib cage with your fingers diagonally across. Basically, what you're doing is your fingers are following the ribs, and the heels of your hands are pointing down towards the diaphragm, okay? And what you're gonna do is you're just gonna go along with the person's breathing, the breathe in regular, a couple of times, and when they get to the exhalation, you're going to create a stretch into exhalation, and then release. Don't take your hands off, just let the inhalation happen, and then stretch into exhalation, and then let the inhalation happen just to get the feeling of it. That's the beginning. Okay, so put your hands in a diagonal so that your fingers are facing along the ribs, your heel of your hand to the diaphragm, and then just do your regular breathing. And I get into the rhythm with her, and as she breathes out, I'm going to pull my hands down and together, and then just release them as she breathes in. Pull my hands down and together, and release it as she breathes in. Okay. So now I'm just getting the hang of it. Then what's going to happen is that when, as I'm pulling down, I'm going to give an extra little stretch down and ask her to take a deep breath in. Okay? So again, I'm going down with her, and then again we're breathing, and bringing down, and breathing, and it's that same coordinating. Okay, it's that same coordinating your stretch and your command to breathe in. Okay. So that's if you want to emphasize the inhalation. We're still going to work on emphasizing only inhalation, okay? So can you think of a situation where someone can inhale fine with one half of their chest and not so fine with the other half? So, Scoliosis, perhaps. Stroke. Just two.
Damaged phrenic nerve.
Damaged phrenic nerve would, if it's unilateral, okay, unilateral damage of the phrenic nerve.
Maybe rib on that side.
What do you mean a rib?
Affected.
The rib is affected. Well, you can have
External intercostal and intercostal muscles on the affected side.
Okay, so You can have a weakness of the intercostal muscles, which might be due to what? Nerve paralysis, trauma of what area? Okay, they could have, a pneumothorax wouldn't necessarily paralyze the intercostals. It would have to be something that's like a Brown-Séquard syndrome or some kind of spinal cord injury to one side. What else?
First, I have on look to what Carr says, maybe a QL weakness on one side. It kind of affects how the muscle works for the back nerve. It says attachment to the 12th nerve.
If the QL were particularly tight and not allowing the ribs to elevate, possibly, but that's a possibility, but not a strong probability. What about someone who's had breast lumpectomy? What about someone who you had something kind of?
Yeah, I was just gonna say like post-surgery, if that's something
Yeah,
that's
a
on one side.
thoracotomy. Someone who has burns on one side of their body. So, and those are people who can have limited excursion on one side of their chest. Or you can have somebody who has bilateral limited excursion, like, who would that be? What kind of diagnoses are you talking about here? Huh? Someone who is tetraplegic or high paraplegic,
TBIs.
TBI, or bilateral hemiplegic.
Patient that might have been previously on the vent.
On what?
Previously on the vent.
Yep, someone who is coming off a vent.
Polio?
Polio, fortunately, we don't see much of that anymore, but what's similar to polio? Guillain-Barré. What about people who have chronic obstructive lung disease, asthmatics, a lot of different people, okay? So what I did just before, with my hands equal on both sides, that's for somebody who needs improvement in bilateral chest expansion. For someone who has problems with one side, like all the first people that we talked about, you're gonna do repeated contractions like you did with bridging. So let's say your left side is weak, and so when you take a deep breath, your right side expands a lot and your left side is less so, okay? So release and then just breathe, regular. Okay, and breathe in and stay there. Now get left side, bring the left side open the left side, all the lungs, all the air to the left side and release. And breathe in, hold it there, left side open, left side, and release. Okay? So what I do is let her expand until her right side has gone about halfway, okay? And then I ask her to hold it there. And as she's holding it, okay, I'm giving her resistance to the hold. In other words, I'm trying to pull her in, push her into more exhalation. So she's working maintained isometric on the right chest wall, and then I do the stretch on the left side. And it's, again, 2 or 3 stretches, and then release, then exhale, okay? And you wanna say Fill up the left side, bring the left side, open the left side, bring the air to the left side, anything that you want, or the right side, depending on what you're working on. Okay? So, there's just regular breathing, and then there's repeated contractions breathing, and that's all to increase exhalation. Okay? Now, if I wanted to scratch that, it was all to increase inhalation, okay? And then if I wanted then to increase exhalation, where do you think my thumbs should go, or my resistance?
Up.
Should go under the diaphragm, okay? So that would be then, breathe in, and then my thumbs switch to here and then out. Okay, breathe in and push into my hips, breathe out, bring them down, 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 and then breathe in and then out, 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 out. Okay, so basically you're switching your hands because you want to give the ribs a place to go down here. Okay? So this is a direct breathing technique as opposed to the D2 flexion extension that we did, which is using the extremities to get the trunk to expand. This is putting your hands on the rib cage to enhance motion. Okay? All right, so let's go practice that. Practice it with enhancing bilateral inhalation, unilateral inhalation, and then exhalation. Okay?